Now I will be removing the tube. Before entering the patient's room, I want to check the doctor's orders and verify that the tube actually needs to be removed. Once I've done that, I will gather my materials, but for purposes of the video, my materials are already inside of the room. And then I would wash my hands. I want to knock on the patient's door and announce myself before entering. Nursing. Once I get into the room, I want to explain the procedure to Ruby. I'm going to raise the bed to a comfortable working position when I do that. So, Ruby, today we're going to be removing your NG tube. Before doing that, though, I need to listen to your bowel sounds. I also need to check to make sure that you haven't had an enteral feeding in the last 30 minutes. And I need to check your tolerance for an oral diet. So, first I would acetate. And so after I have done those things, I want to place Rudy in a high Fowler's or sitting position. Once I have Ruby sitting upright, I'm going to detach the tube from her gown. And I'm also going to clear the tube of any secretions by instilling 10 milliliters of air. I'm going to wash my hands and glove again. As I'm doing that, I'm going to provide Ruby with a Kleenex just in case she needs it as I remove the tube. And I'm also going to get a small towel to drape Ruby. So when I do remove the tube, secretions don't fly. So Ruby, what I need you to do is hold your breath as I remove the tube, and I'll let you know when. You ready? Okay, hold your breath for me. While Ruby's holding her breath, I'm going to start removing the tube quickly but gently. I'm going to remove the tube. Once the tube is removed, I want to discard the tube. I also want to check Ruby for any signs of bleeding or skin breakdown. And I'm going to also help her with any nose or mouth care that she may need. Once I've done that, I can deglove. I'm going to wash my hands and just explain to Ruby the importance of reporting any nausea, any vomiting, any abdominal distension, or any food intolerance. I am going to ask Ruby about her comfort. Ruby, are you comfortable? Do you need anything? Is there any pain? I'm going to lower Ruby back down to a comfortable position. I'm going to lower the bed all the way down and raise the side rails and leave her with the call light. Over the next, I will monitor her I's and O's every 8 hours. I'm also going to run a nutrition scan, and I'm going to document the time and the date of the procedure, how well Ruby tolerated the procedure, if there were any complications such as nausea, vomiting, any abdominal distension or any food intolerance. And that is all. Oh, I think I did, but I would have washed my hands before leaving the room.